Today I'll be talking on an important topic, that is chlamydial infections, which is a common sexually transmitted infection that may not sometimes cause infections, but it affects the people of all ages, but it's more common in young women, which spreads by sexual contact, but they are treatable cases. And this, as I mentioned already, many of the people who infected may not develop symptoms, but they can still infect others through sexual contact, and somehow they'll be considered as a lifestyle associated infections also in young age people. So this is a brief introduction about the chlamydial infections, and now we'll move on to a case scenario related to this particular chlamydial infections. This is a case scenario. A 25-year-old woman presented to obstetrics and gynec OPD with spotting between the menstrual cycles. On examination, she gave the history of multiple sexual partners in the past 2 years without using any protective barriers. On examination, no vaginal discharge, genital lesions or sores. Vital signs normal. The genital exam reveals normal vulva and vagina. Cervix appears inflamed and bleeds easily with a purulent discharge from the cervical os. Right? Bimanual examination is normal, and cervical swab for gram staining was not informative. So gram staining is not informative. And KOH mount also not showing any kind of fungal elements. HIV test and pregnancy tests were negative, and the cervical swabs were smeared and stained with Leogal's iodine, which showed a reniform inclusion bodies inside the infected cells. This is the type of presentation by the chlamydial infections among the females, which involves the genital tract. So with this, we will move on to learn about these chlamydial infections in detail. The general properties of this chlamydia are their obligate intracellular bacteria which produce this number of diseases. The earlier names for this chlamydia were the PLT agent, psittacosis, lymphogranuloma, trachoma producing agents, and trick agents, that means trachoma inclusion conjunctivitis agents. Its life cycle takes on two forms. One is the elementary body, and which is an extracellular infective form, and cell wall possesses the rigid trilaminar structure. And the number 2 is the reticulate body, which is a multiplying form of this bacterial cell. So the life cycle is seen in two forms. One is elementary body and reticulate body. Previously, they were thought as viruses, but we are considering as bacteria. The reasons are, the viruses usually they are obligate intracellular organisms. Of course, this is also intracellular organism, and here there is no growth on cell-free medium or artificial medium like viruses, and pass through the bacterial filters while they are filtering. So they are filterable bacteria, and intracytoplasmic inclusion bodies are produced. So that's why they are thought as viruses. But why we are considering now them as bacteria? Like bacteria, they possess both DNA and RNA, and they are possessing gram-negative cell wall, and they can multiply by means of binary fission and synthesize their own nucleic acid, but viruses can't produce their own nucleic acids. They depend on the cells of infected or the functioning cells of the infected individuals or hosts and killed by antibacterial agents. So, the antiviral agents are not effective, whereas antibacterial agents are effective against this. That is why people are considering them as bacteria. And if you see the growth and multiplication, the growth is initiated by the attachment of this elementary body to the specific receptors on the host cells, especially the respiratory epithelial cells and the macrophages, and then thereby they will be endocytosed. Once they endocytosed inside the macrophage, they resist the phagocytosis. They resist the phagocytosis. How is it possible? We will see now. The fusion of phagolysosome with cellular lysosomes will be prevented. So, the fusion of phagolysosome with cellular liposomes will be prevented, thereby it prevents the phagocytosis. And in the presence in the phagosome, the elementary body transformed into the reticulate body, which is a multiplying form of this bacteria, and after that again they will be converted into elementary body, and the group of these elementary bodies inside the cells are known as inclusion bodies, and these inclusion bodies may be round or pear shaped, otherwise called reniform shaped. And elementary body released from the host cell, that means the infected host cell, after by 48 hours, and they can infect a new host or new cells. Pathogenesis, the elementary body attached to receptors of the non-ciliated columnar epithelium or cuboidal or transitional epithelial cells on mucous membranes of the conjunctiva and the genitourinary tract. So, eye and also genital tract are commonly involved, or genital mucosa are commonly involved, and these elementary bodies possess lipopolysaccharide protein complex, which is responsible for the pathogenic mechanism or pathogenesis, right? They are responsible for their pathogenesis. And if you see other biovars of this particular chlamydia, they are lymphogranuloma venereum biovore, which multiplies purely on the mononuclear phagocytes seen in the lymphatic system and produces granulomatous lesions, whereas the chlamydia can produce, or chlamydial species can produce mucopurulent infections or acute infections where the neutrophils are involved, but here the macrophage activity is more and produces granulomatous lesions by lymphogranuloma venereum biovars of chlamydial species. See the life cycle or pathogenesis of this particular bacterium. See, the extracellular infectious what we call elementary bodies gets attached. They gets attached to the cells to be infected, and then these what we call elementary bodies will be taken inside the cell, through a vesicle, and then once it's entered into the infected cells, 1 to 8 hours after the cell, the reduction of MOMP will appear on the elementary body. That MOMP means major outer membrane protein, which is mainly responsible for their pathogenesis. And with this help of this MOMP, major outer proteins, they inhibits lysosomal fusion, and thereby it causes for resistance to the phagocytosis. And then 9 to 18 hours after the infection, what will happen? The reorganization of elementary body into the reticulate body, and the DNA reorganization also will occur, and RNA and protein synthesis will start, and after that they start by division by means of binary fission inside the RBs, inside the infected cells. And after that, after 18 to 24 hours, the fusion of inclusion bodies, these inclusion bodies will get fused and produces a separate bodies which are known as intermediate bodies. They are known as intermediate bodies. These are called intermediate bodies. And these intermediate bodies, after the DNA condensation with the reticulate body, and then form the elementary bodies. That will happen after 24 to 48 hours, otherwise called 1 to 2 days. Then these particular elementary bodies, they mature further and produces the effective or infectious elementary bodies, and these elementary bodies after 48 to 72 hours get released from the infected cell, and now they are again able to infect the new cell. In this way, by 2 to 3 days, the infected cell can release a different population of these elementary bodies to infect the other cells. And now the Chlamydiaceae family, they have got some species which can cause the human diseases. If you see it, the Chlamydia trachomatis is having two important biovars. One is the Chlamydia trachoma biovar, and also number one is LGV or lymphogranuloma biovar. And this trachoma biovars, also known as trick agents, like A, B and the Chlamydia trachomatis, A, B, B, and C comes under this particular trick agents, and they are responsible for they are responsible for the trachoma and non-gonococcal urethritis and adult inclusion conjunctivitis. And then the next serovars like D, E, F, G, H, I, IAJK, they are responsible for the genital infections or genital chlamydiasis, and also the neonatal conjunctivitis and infant pneumonia. And lymphogranuloma venereum biovars like L1, L2, L3 and L4 are responsible for lymphogranuloma venereum. Lymphogranuloma venereum. Okay. Venereum. And then Chlamydia pneumoniae is another important species which is responsible for pharyngitis and bronchitis. And most dangerous form of this disease is community acquired primary atypical pneumonia. Community acquired primary atypical pneumonia also produced. Next one is Chlamydia psittaci, which is responsible for psittacosis, primarily for birds. Later they may get transferred to human beings. Now we will see about the Chlamydia trachomatis. The mode of transmission is direct contact from the infected individual, either by means of the contaminated fingers or hands, and also the fomites from the eye discharges. And perinatal transmission also possible, and sexual transmission is, of course, as I mentioned already, it's a main mode of transmission. After an incubation period of 1 to 3 weeks, the clinical manifestations appear, but majority of the cases are asymptomatic. They act as reservoirs in the community. Ocular infections are common among the 2 to 3 years old and also the young children, but whereas the genital infections are very common among the adolescents and the people who are having the multiple sex partners and abnormal sexual practices, and presence of another sexually transmitted disease also favors the infection, and the people who are using oral contraceptive pills are prone for these chlamydial infections. The clinical syndromes produced by this Chlamydia trachomatis, among the men, they produces local infections like conjunctivitis, urethritis and prostatitis, and they may be complicated as Reiter syndrome, which is the triad of conjunctivitis, urethritis and arthritis, and epididymitis also possible. And the most important sequelae or complication is chronic arthritis, bit rare, and also the infertility, bit rare in case of male. In case of women, they produces urethritis, cervicitis, and sometimes the proctitis also possible. And the main complication with this is salpingitis and PID, that's pelvic inflammatory disease. Perihepatitis, around the liver the inflammation will be seen, and pelvic peritonitis. These are the things most common complications, and then later life they may suffer with severe infertility. This is one among the causative agents causing for infertility. Sometimes if the people, even though they become pregnant, sometimes the ectopic pregnancy is possible, and chronic PID and chronic arthritis rarely seen among the females. Whereas in infants, it causes for conjunctivitis, but mainly presents as pneumonia, pharyngitis, and also rhinitis, and 60% of the infected mothers can cause for the transmission of this particular infection, and 4 to 6 weeks after birth, people usually suffers with this particular kind of disease. And sequelae are rare, if any. It may be mostly in the form of chronic lung disease. This is how they can infect men, women and infants, that means in all age groups, and produces different varieties of diseases. This is the overall view of these infections produced by Chlamydia trachomatis. In men, if you see, the infections are produced by the serovars D2K, and mainly presents in the form of non-gonococcal urethritis, and after an incubation period of 7 to 10 days. But here the majority of the cases are asymptomatic, and if at all symptoms are present, they are seen in the form of dysuria, urethral irritation, and watery discharge from the urethra. Watery like discharge, see the watery like discharge from urethra you can see in these particular cases. And post-gonococcal urethritis also possible after 2 to 3 weeks after the recovery from the gonococcal urethritis by this particular bacterium. That's what I already mentioned, that the already existing STD will favor the infection of these chlamydial infections. And epididymitis and proctitis, the most common among the males. This most common cause in male by the Chlamydia trachomatis. Then the Chlamydia trachomatis infections in the women, if you see, it is seen in the form of mucopurulent cervicitis. See here you can see this, the os, external os of the cervix, and you can see here the mucopurulent endocervical discharges are seen here. And also you can see the edematous cervix with erythema, and they are more friable. If you touch them, that particular area, you can see the bleeding. And remember, even though it's the most common type of, that is mucopurulent cervicitis is the most common type of presentation by the Chlamydia trachomatis, but 70 to 80% of the infected individuals are asymptomatic. If at all symptoms are present, they may be seen in the form of mucopurulent endocervical discharge. And next one is urethritis, usually asymptomatic, if at all present, as I mentioned already in case of male, dysuria frequency and pyuria, thus presence of pus cells in the urine also possible. And these infections may be complicated in the form of endometritis, salpingitis and PID, bit rarely, and not rarely, but not that much common like when compared to the mycoplasma. And perihepatitis, which is also known as Fitz-Hugh-Curtis syndrome. And perihepatitis, which is a complication of the Chlamydia trachomatis in the liver, is known as Fitz-Hugh-Curtis syndrome. And of course, here you can see the involvement of the tubes and how it is responsible for pelvic inflammatory disease, and finally causes for PID. Adult inclusion conjunctivitis, this is also known as swimming pool conjunctivitis or acute follicular conjunctivitis produced by the pseudovirus T2K. And here you can see the bilateral red eye. See, on both sides you can see the red eye, ocular discharge and marked hyperemia is present. And here also you can see the lot of discharges from the eye. And in case of neonatal conjunctivitis, which is also known as inclusion blenuria or ophthalmia neonatorum, this ophthalmia neonatorum also produced by the gonococci. The gonococci also responsible for ophthalmia neonatorum, but this neonatal conjunctivitis by the chlamydial species is more common than gonococcal ophthalmia neonatorum. This is always possible after 3 weeks to 3 months after the birth, and where you can see the swelling of, the severe swelling of the eyelids with the purulent discharge and severe hyperemia also present. Here you can see the severe hyperemia, the redness of the eye. This is produced by the serovirus A, B, BA and C, and they produce this in the form of, this trachoma is presented in the form of chronic keratoconjunctivitis. And modes of transmission, if you see, that is the direct contact from the infected individual or contaminated fomites. And the common age group involved are preschool children. Preschool children, that's around 3 to 5 years age group children are commonly involved. And this present in the form of acute infection by showing the follicular conjunctivitis. The follicles are seen in the palpebral conjunctiva. See, here you can see the many number of follicles. Many number of follicles are seen, and they later will be converted to the papilla, big papilla like things, and papillary hyperplasia seen in the palpebral conjunctiva. And also in the earliest stage you can see the conjunctival involvement like this on the bulbar conjunctiva. Stages, because of the neovascularization, that's Panus formation means that's neovascularization and gets organized on the conjunctiva and leads to cicatrization. That is cicatrization, or otherwise called kind of hardening of the conjunctiva. And later the limbal or palpebral conjunctival scarrings may occur. Here you can see the scarrings of this palpebral conjunctiva, and also entropion also possible, that is eyelashes will turn into the inward. See here the inward turning of the eyelashes, and this entropion also possible. This entropion results in repeated rubbing of the hair on the cornea, results in opacity and blindness. That's the reason why it may causes for millions of people blindness in India even today. After the the most important cause for this blindness, infectious agents is, among the infectious agents is this Chlamydia trachomatis. So this is the most common infectious agent causing for blindness all over the world. Venereum, this produced by the Chlamydia trachomatis serovirus L1, L2, L3, of course L4 also. In early stages, again this is also a sexually transmitted disease, and early stages, that means 3 days to 6 weeks after infection, the lesion appears as a painless papule or ulcer, either painless papule or ulcer, and later stages because of the involvement of inguinal lymph nodes, the lymph nodes gets enlarged, they become tender and soft, which are known as buboes, and buboes will break down and forms the chronic fistula. Here you can see in the diagram how the chronic fistula will be formed. See, the lymph nodes are enlarged and they ruptured out and left the fistula. And then in the final stage, that means in the stage of untreated cases, the rectal strictures may be produced, and most important thing is esthymine. This esthymine means that's edematous granulomatous hypertrophy of either penis, scrotum or vulval region of the genital tract. Of course, here I am showing the specimen of the vulva, where you can see this is a female case. In the female, these are all what I am showing here. These are all the vulval parts of the female genital tract, and where you can see the edematous hypertrophy of the vulva. And Parnard's ocular genital conjunctivitis also possible, where the conjunctivitis associated with periauricular, submandibular and cervical lymphadenopathy. This is another type of presentation by the lymphogranuloma venereum, serovars. The aspects are common in sub-Saharan Africa, Middle East and Southeast Asia, including India, and leading cause for blindness, nearly 5 to 6 million patients or individuals per year. And if you see this kind of infections are very common among the females when compared to the males. So this when compared to this males, the females are very commonly suffers with this particular infection. And if you see the age and sex wise distribution, this is very common among the age group. First we will see the age group. The age group is between 15 to 24 years age group. This is a common presentation. And when compared to the men, females are commonly suffering with this kind of infections. And diagnosis of chlamydial infections. The samples to be collected are the endocervical swab and the urethral swab and also the corneal scrapings. And then we have to prepare the smears to subject to the microscopic examination. The Lugol's iodine staining of the smear for smears from either from the cervical swab or corneal scrapings will show the reniform shaped inclusion bodies, which are nothing but glycogen matrix of the infected cells, the inclusion bodies of the infected cells. And mainly this kind of reniform inclusion bodies are demonstrable by the infection with the Chlamydia trachomatis, whereas the other species of Chlamydia can't show this kind of reniform inclusion bodies by the Lugol's iodine stain. That is a very important point. And by using the special media, special stainings like Castaneda's media or Macchiovella media, or staining, or Gimenich stains also can demonstrate the inclusion bodies from the trachoma and also the lymphogranuloma venereum and psittacosis cases. In case of trachoma, the inclusion bodies are called as Halberstader-Provozoki bodies, otherwise called HB bodies. Halberstader-Provozoki bodies are HB bodies. Here you can see the inclusion bodies. And here also you can see the inclusion bodies. Here. So in different diseases we call these inclusion bodies with different names. In trachoma they are called HB bodies, and in case of lymphogranuloma venereum they are considered as Miyagawa corpuscles, and in psittacosis they are called as LCL bodies. Culture of the clinical specimens, the sensitivity is variable, culture 50 to 90%, and they have got high specificity. If the culture is there, definitely we can say. If the culture is not there, we can't say that the person is not suffering with the disease. So the cell line cultures are used, or Mackay cell line cultures with cyclohexamide as selective agent. After 2 to 7 days after incubation, you can see the inclusion bodies. Like these are the inclusion bodies in Mackay cell line cultures. And other cell line cultures used are Hep2 cell line cultures and HeLa 2 to 9 cell cultures, and yolk sac of 6 to 8 days embryonated egg also can be used. And if you see the HeLa 229 cell line cultures are commonly used. These are the normal cell lines of the cell line culture. After infection, you can see the cells like this. The skeletal structure of the entire cells will be altered. Here also you can see in this particular photograph, see this is the infected cell, and whereas these are all the normal cells. These are all the normal cells. See here also this is the infected cell, and where the entire cytoskeleton has been altered by the infection with this chlamydial species. Rapid tests available are direct fluorescent antibody test to detect the antibacteria with fluorescent antibody, and ELISA or enzyme linked immunosorbent test set to detect the antigens, of course sometimes antibodies too, and the serological examination or serological tests available or micro immunofluorescent test or MIF to detect the serovar specific MOMP antibodies, that is major outer membrane protein antibodies, and the significant titer will be considered as 1 in 512. And nucleic acid hybridization test or NA probe test, this is a test of choice by the CDC, and where we can detect specific DNA or RNA sequences of Chlamydia trachomatis. Treatment for uncomplicated genital chlamydial infections, according to the CDC guidelines, azithromycin has to be given 1 gram orally in a single dose, or doxycycline 100 milligrams orally twice a day for about 7 days. But in case of lymphogranuloma venereum, we have to give it for 21 days. And for the pregnant woman, we have to prefer the ampicillin 500 milligrams thrice in a day. And then the alternative regimens for this treatment is erythromycin 500 milligrams orally, TID for 7 days, or the ofloxacin 300 milligrams orally twice a day for 7 days. These are the alternative regimens to treat this chlamydial uncomplicated genital chlamydial infections. And in case of neonatal pneumonia, according to the CDC, we have to give 50 milligrams per kg body weight. The erythromycin orally has to be given in 4 divided doses for 14 days. And azithromycin 1 gram as single dose if the individuals are babies or if the individuals are more than 45 kgs. Of course, it's related to the adults or for the pregnant woman, not for the neonatal pneumonia. If the neonatal pneumonia cases, of course, this most of the times the individuals or babies are not of more than 45 kgs. There is some mistake here in typing of this particular point. Now, why and for whom we have to do the screening test for chlamydia, and why? To reduce the incidence of pelvic inflammatory disease by more than 50%, and to identify the asymptomatic individuals, and also because these asymptomatic individuals act as main transmitting agents. They act as transmitting agents by harboring this bacteria, and decrease the prevalence and reduce the transmission of disease. For whom we have to do it? We have to do it for young women with multiple sex partners and pregnant women in the first and third trimester of the pregnancy. This Chlamydophila, the members of this Chlamydophila was isolated from conjunctiva of child from Taiwan in 1965 and named them as TWV183. TWV183, and isolate from the pharyngitis as named as AR9. These are the two important serotypes identified or isolated from these two particular different areas. Previously, it was believed as Chlamydia psittaci due to the production of type of inclusion bodies, and later these two were named as Chlamydia pneumoniae, TWAR agents, and finally reclassified under a new genus Chlamydophila. So, this Chlamydophila is a new genus from this particular Chlamydiaceae family. Chlamydophila pneumoniae is an exclusively human pathogen where the person-to-person transmission is possible by means of inhalation, and atypical pneumonia is the main presentation with this particular bacterium. Here you can see on chest X-ray, you can see the peribronchial and also the peribronchial and perivascular infiltrations are seen, and also on the biopsy of the particular area will show the many number of infiltrations, interstitial infiltrations, and the people will suffer with fever, non-productive cough, and no leukocytosis in the blood, and upper respiratory tract infections are manifested in the form of pharyngitis and sinusitis. This Chlamydophila pneumonia also complicated as the atherosclerosis and also Alzheimer's disease, that is due to the cross reactivity with the outer membrane protein of this bacterium. This outer membrane protein can cross react with the human brain cells and results in autoimmune process, and so the Alzheimer's disease is a complication. And this Chlamydia pneumoniae also responsible for exacerbations of bronchial asthma and also other chronic obstructive pulmonary diseases. And then the diagnosis is based on microimmunofluorescence test, ELISA and PCR test. But almost all the best test would be the PCR when compared to the other test. And treatment is by using doxycycline or erythromycin for 10 to 14 days. Citus is a pathogen of parrots and macaws, poultry. This turkeys and ducks are commonly suffers, and they are reservoirs for the human infections. And inhalation of aerosols from birds, direct contact with the pet birds also possible, but there is no possibility for person-to-person transmission. After an incubation period of 5 to 19 days, the people will suffer with the clinical manifestations. And this psittacosis is manifested in the form of mild flu to severe or fatal pneumonia, where you can see this on the chest X-ray. You can see the inflammatory process of pneumonia in the chest X-ray. And septicemia, this bacteria spread to many organs and cause for septicemia also, and produces typhoid-like illness with fever, splenomegaly, and rash on the body. See the rash on the body, and this rash is popularly known as harder spots. And this is again the CT scan examination of the fatal pneumonia from the psittacosis. See how dangerous the arrow, again the same arrow is showing the dangerous pneumonia of the lungs on CT scan examination. And bronchoalveolar lavage fluid has to be collected, and with that we have to do the microimmunofluorescence test, which is more sensitive, or we can subject it for Giemsa stain, and where you can see the LCL bodies. See, these are all the LCL bodies. Inside the cell you can see many number of inclusion bodies, round or pear shaped inclusion bodies are seen inside the infected cells. The chlamydial infections and their modes of transmission and the site of infections and various complications produced by these chlamydial infections. Thank you very much.